Tracking the vaccine this afternoon. There are a lot of questions about herd immunity. You've heard a lot about it and how these two vaccines the FDA has authorized could help us get there. Fox Carolina's Margaret Burnquist talks with an expert from Clemson about when we might be able to stop wearing a mask.
As we hear about more Americans beginning to receive the COVID-19 vaccine, it marks a new phase in this battle against the pandemic. So what is next and what is the end goal exactly? We are joined by Leor Rennert, Assistant Professor of Public Health Sciences at Clemson University and biostatistician as well. Thanks for being here.
Yeah, it's nice to be here. Thanks for having me.
Well, vaccines are to help us reach herd immunity. But before we get into that, explain how these two vaccines work.
Sure. So before I explain that, it might be worthwhile explaining what happens when we actually get infected with SARS-CoV-2, the virus that causes COVID-19. So this eventually generates these special cells that recognize the virus and fight it off. So these special cells will be ready to fight a future infection. They're not going to help us the first time we get infected because they weren't ready yet. So that's where the beauty of the vaccines come in. So mRNA vaccines, such as Pfizer and Moderna's vaccine, cause your body to generate these special cells without you having to actually get the disease first. They work by producing a harmless protein unique to SARS-CoV-2, which does not actually enter our cell's nucleus and has no possibility of infecting us or altering our DNA in any way. However, our body does recognize this protein as a foreign object and begins to generate these same special cells that are trained to fight the infection. So that if we do get infected in the future, our body's going to be ready to immediately fight it off.
Okay. Well, now let's get into herd immunity a little bit. Explain what herd immunity is and what needs to happen for us to reach that.
Sure. So herd immunity occurs when enough people become immune to the disease, making it unlikely that the disease can spread in the population. So this ends up protecting the entire community, even if there's a small fraction of those who are not yet immune, because the virus doesn't have enough room to spread. Now, herd immunity is usually achieved through vaccination. It could also be achieved through natural infection, but this is dangerous, and I'm happy to go into examples of where that hasn't worked out.
Okay, the goal is you want people to get that vaccination. There have been some concerns over how quickly this vaccine was developed. What do you want people to understand about that?
So the vaccine is safe and it undergoes a rigorous process. So first, any vaccine or any drug or treatment that receives emergency use authorization or is authorized by the FDA has to go 3 stages of clinical trials. The first one is a phase 1 clinical trial. If the vaccine is harmful, it does not pass. It cannot get out of there. It's killed on arrival. The next phase, they actually test for effectiveness on a smaller population. If the vaccine is effective and there's no serious side effects, it moves on. In phase 3, they test it on a really large population. So in this situation, we had 70,000 participants testing Pfizer and Moderna's vaccine, and those who did not receive the vaccine are 20 times more likely to get COVID.
Well, finally, medical officials are reminding people that mask wearing and social distancing measures are still critical, even as more people get the vaccine. Talk to us about why that is, and at what point you think the precautions can be relaxed.
So first, I want to say that we still need to continue to be vigilant and wear masks and practice safe social distancing throughout these cold winter months. We're already seeing a surge in cases, and many hospitals across counties are coming very close to reaching capacity. But I can promise you that if enough people get vaccinated and we all continue to wear masks, there is a good chance that we can return back to normal at some point this summer. But this takes everybody buying in. And if too many people refuse the vaccine, we may never achieve herd immunity. And that's why it's important to continue wearing masks, even if you get vaccinated, since even if the vaccine protects you from becoming infected, we still don't know if you can spread it to others. But once enough people get vaccinated and we achieve herd immunity, we can put all of these masks away.
Okay, wonderful. Well, thanks for the information, Dr. Rennert, Assistant Professor of Public Health Sciences at Clemson University. Have a great rest of your day.